Welcome, everyone, and thank you so much for joining us for today's event on urban health in Africa, a collection of essays by 38 scholars addressing critical issues at the intersection of health and urbanization across Africa, which is home to many of the world's fastest growing cities. Covering a broad selection of topics and focusing on specific cities throughout Africa, the book examines everything from education and economic development to climate change, pollution, and the role of data in urban health and development. My name is Stacy Fox, and I'm the Executive Director of the Initiative on Cities at Boston University. The initiative is a global urban research center that connects research and practice to advance the livability and resilience of cities around the world. We are so thrilled to be partnering with the BU School of Public Health on today's event, and we're deeply grateful to our speakers, whom I'll introduce shortly, as well as to our moderator, Dr. Elaine Unsuisi, who is co-editor of Urban Health in Africa. Elaine is an associate professor in the Department of Global Health at the BU School of Public Health, and she's an internationally recognized data scientist and a leading voice on the use of data and technology to advance health equity. She's collaborated with local health departments in the United States to improve disease surveillance systems. She's worked with international organizations like UNICEF and served as a Data and Innovation Fellow in Sierra Leone's Directorate of Science, Technology, and Innovation. Thanks so much for organizing today's discussion, Elaine. So quickly, here's what you can expect this morning or this afternoon, wherever you're signing in from. We're going to begin with some opening remarks about the book, followed by several brief presentations on case studies featured in urban health in Africa. We'll then move into a panel discussion with our speakers, moderated by Elaine. And after that, we'll open the floor to some audience Q&A. So please feel free to submit your questions throughout the webinar using Zoom's Q&A function. A quick note that this webinar is being recorded for later viewing, and we'll post that to our website, which I'll drop in the chat a little later on. So because of the number of speakers that we have today, I'm going to introduce each speaker as they present. And it is my pleasure to introduce our first speaker, Dr. Blessing Mberu, Senior Research Scientist and Head of Population Dynamics and Urbanization at the African Population and Health Research Center. Blessing is an honorary professor of demography and population studies at the University of Witwatersrand and serves on the Expert Advisory Council of the International Society for Urban Health. With Elaine, he is co-editor of Urban Health in Africa. So I'm going to stop sharing my screen, and Blessing, I'm going to turn it over to you. You have the floor.
Stacy, I wanted to share my screen, but you need to allow me to do that.
Sorry about that. Let me do that right now. There you go. You should be able to do it now, Blessing.
Okay. All right. So I hope you are seeing my screen.
Yes, looks great.
All right. So thanks you, Stacy. Thanks everyone for coming. State of urban health in Africa is a big topic, but let me proceed with sharing with us our context. The context is Africa is the least urbanized globally, but it is the most urbanizing. In terms of rate of urbanization, it's going the same trajectory of the rest of the world. And it's projected that 55% of Africa would be urban by 2050. Cities continue to offer greater amenities, better employment opportunities, and better services. But they also concentrate risks and hazards for health, exacerbated by majority of urban dwellers in the region living in slums or in slum-like conditions. Okay, those areas are called informal settlements. And if you come to any major city, you will have a physical evidence of vulnerability, of marginality, as you look at these slums. And those living conditions are detrimental to health. If you look at the slide here, you will see most of the time it's always a case of two series. You will see well planned out settlements, but you will also see some evidence of chaos where the houses are all over the place, the materials used are poor, and all of that. So currently 1 billion people are estimated to live, just a minute, estimated to live in urban slums or informal settlements worldwide. But Africa's case is 1 in every 4 Africans is projected to be living in slums by 2030, 1 in every 4. And then these slums are really complex. They are not homogeneous, okay? And they are not usually visible in the data used for policy and decision making. Their indicators are often buried in what we call urban averages. Urban averages that blur inter and intra-urban inequities. Most of the time, you have data that talks about urban versus rural areas. And what that does is that you have averages that ignore the critical living, adverse living conditions of those who live in these informal settlements. So making the invincible visible and provision of context-relevant evidence is critical in the search for pathways to urban solutions, pathways to solutions. Of course, that requires a lot of investments. Investment in data, investment in capacity to analyze, to interpret, and also investment in capacity to use the data across the urban space. And I want to acknowledge it's not all gloom and doom. In the last couple of decades, there have been a lot of investments to address data gap, to address evidence gap. And those investments have given us unique data sets that are mostly aggregated at local levels. So it gives us specific living and health conditions of slum areas. Okay. So, and these collectively have begun to contribute rich granular evidence for policy and action, okay, in the important search for pathways to reduce health inequities and to improve the living conditions among the urban poor, both in Kenya and the rest of sub-Saharan Africa. So things have moved. Just a moment, this is responding. Excuse me. Okay. So the problems are visible in urban areas of Africa, particularly urban informal settlements. The problems are visible: overcrowding, poor garbage disposal, poor drainage, flooding, poor housing, the near absence of the public sector and infrastructure. Okay. However, the emphasis today are focused on solutions that work. Solutions that work, they need to be identified, they need to be scaled up, they need to be made visible. So solutions has remained an important area of focus. And this slide shows you the rate of urbanization, the growing, it is heading towards 50%. But what is important here is the fact that if you look at the data on the right side, you see NCS S222 is Nairobi cross-sectional slum survey. This is a survey we did to have a representative sample of the households that are in slums, okay? But there are data from the Kenya National Demographic Health Survey, Urban Kenya, Nairobi as a whole, where you have the averages. You also have national indicators. You see childhood mortality, you see other indicators. What is critical here is that if you look to the slum column, what you see is that slums have worse indicators, whether it is vaccinated by 12 months, whether it is infant mortality, prevalence of fever. The slums have worse conditions than rural areas. And I think this is important because if you want to address the challenges, you need to understand the problems. Slums have worse, if you see under 5 mortality rate, it's 79.8, and rural areas is 56. And the rest of Nairobi is actually 22. National indicator is 52. So the slums have very worse indicators. And we think it's important to have data at this level so that local governments, implementing agencies at those levels will be able to identify the problem, what is working, what interventions they should prioritize, and so on. So data at the local level becomes important. I will just quickly go through this because I'm looking at time. Gaps in urban health research and action. We worked with the International Society on Urban Health for the WHO Urban Health Agenda, which came on stream a couple of years ago. And we did using a lot of methodologies to be able to identify the gaps, both in research and action across Africa. We led the work on Anglophone Africa. So most of what I have here is Anglophone. Another group did the study on the Francophone. But the commonalities are huge. Some of the gaps we saw is lack of skills. In Kenya, for instance, functions were devolved under the new constitution. Kenya has 47 new counties. So those are 47 new counties of counter attraction, new counties, new centers of investment in policy and action. However, function was devolved, but capacity was not devolved. So if you go to many of these counties, they lack the basic capacity they need, lack of skills. So the need for a critical mass of urban health research expertise and capacity building for local governments and implementing agencies. We have this narrow view of health. WHO defined health more broadly to the extent that when you talk about health, only 20% is healthcare. But there is this emphasis on healthcare. The rest 80% are social determinants of health. And that narrow view needs to be broken so that people will begin to see health beyond just healthcare. When you are sick and you need a doctor, first, when you need a doctor, you're already sick. And when you go, you are treated, you are given prescription, but you are sent back to the same environment that really made you sick. So we see that gap in the region. A lot of evidence is needed, a lot of capacity building, a lot of engagement and awareness creation. The siloed work among government sectors. There is need for enhancing intersectoral collaboration. Okay, it is still linked to the point I made earlier around narrow view of health. African governments to have their own research funding. We just coming from a meeting on neglected tropical diseases. Part of the challenge is who funds this. If African governments own their own research, I mean, if you look at North America or Western Europe, many of the government agencies fund research, and we are still at the very infancy where it has ever started. Having your own research fund that will help you fund your priorities. That will help you fund your priorities. We also lack robust data to inform urban planning, urban decision making. We also have this top-down approach to programming, where government knows the problem and they gives you the solution. Okay, we lack the bottom-up approach, where you involve communities, involve community groups, harvest rich local knowledge, engage communities who are living within the problems to give you their perspectives that can inform research, that it can inform programming. We also need a lot of robust methodologies that have local underpinnings. For example, we've tested many research approaches. Some of them are like community-based participatory research, okay, using communities to collect data, using communities to define the problem. So those are the research gaps we see. And quickly, I wrote out here specific urban health research gaps, like research on mental health. And I should add here health and well-being, because by the time what we call mental health here, you're already off the hook. The problem have really matured into an illness, into a disease. There are many stressors related to social determinants of health. Okay, we have gaps in study on noise pollution, studies on social and commercial determinants of health. We have gaps in governance of health systems, urban planning, housing, and health, particularly those interlinkages. We study these things as individual issues, but there is a linkage, and we have gap in those kind of knowledge. Intersectionality, climate change, extreme weather events, and health. Waste disposal, waste disposal from across the value chain, from collection to separation to recycling. We hear about waste to wealth. There are very few of that in our region, okay? Urban food and health systems. The role of the private sector, the deployment of technology, okay, including using small, low-cost sensors to collect data on environmental pollution. Those areas are gaps. It is not exhaustive, and I want to get to the end. But we also have opportunities to advance knowledge, to advance practice. The rapid urbanization in the region has attracted a lot of attention. I think it's an opportunity for African governments, African cities, to build new sustainable cities. We are in this whole green revolution, what you might call the fourth industrial revolution. So the cities of Africa are coming of age when they can leapfrog into sustainable cities. We have opportunity around regional objectives. For example, Africa Union Agenda 2063, the Africa we want, the Africa Continental Free Trade Area. These are regional agendas we can build we can leverage to do urban health research and action. There is a lessons we learned from COVID, that for us to be resilient, we need to be probabilistic, particularly in emergency preparedness. We should not continue to be deterministic. When things happen, we begin to run around to look for solutions. We should be probabilistic. So probabilistic emergency preparedness is an opportunity that COVID gave us to be able to develop, of course, human capacity we need to lay the basic foundations for response when emergencies happen. There are also country-level agendas, country-level vision. For example, in Kenya, they have what is called the Big Four agenda. It really addresses a lot of social determinants of health. For example, housing infrastructure. Okay, there is Kenya's Vision 2030. Okay, there are Somalia's vision for for technological innovations. We can leverage on all of that to build an urban health program that will be sustainable, that will be smart, that will solve the problems we are looking at. We have these places that are coming out of civil war, like Somalia, like South Sudan. We can bring urban health agenda into those areas as they rebuild. There is the opportunity around citizen science, especially using young people for evidence generation, for advocacy, for community interventions. There is opportunity to build on the SDG. Okay, it's a global agenda, but there are outcomes that we can easily pursue. You know, like universal health access, leveraging, leaving no one behind. These are opportunities we can leverage on. So I want to go to my last slide here, just to make the last comments. So from what I have gone through, you see that the region is at, in many of the urban health agenda, big agenda issues, we are still at infancy, okay? But we have the tools. We have groups that are ready to work in these areas, who already started working around air pollution, around climate change. So if we are going to address these gaps, we need a lot of investment in data, a lot of investment in capacity building, and a lot of investment in generating evidence on not just health outcomes, but on social determinants of health. We need to highlight how these things come together. Okay, and I think for me, the last point I want to make here is our book on urban health in Africa. I have a copy here. I think it is a modest attempt to begin to address the gaps we identified, both in research and action, and also in utilizing the opportunities that I have itemized. So let me stop there. Thanks for your attention.
Thank you so much, Blessing. That was such a great introduction and really great framing. So up next is Dina Machuve, who will discuss improving education to address determinants of health in Arusha, Tanzania. Dina is the co-founder and CTO of Dev Data Analytics, a data science consulting startup in Tanzania. She also serves on the board of Data Science Africa, a nonprofit training students across African universities in data science for social good. Her research focuses on developing data-driven solutions in health and agriculture. So Dina, I invite you to come on camera and share your screen. Thank you so much.
Yeah, thank you so much for inviting me to share our book chapter, which is a case on Urban Health Africa, which is a case study on improving education to address the determinants of health in Arusha, Tanzania. I hope you can all see my screen.
Yes, it looks great.
Okay, thank you. So I really acknowledge in Arusha and the whole country in Tanzania that education is an important determinant of health and well-being. And normally a well-educated community will be equipped with the skills, values, and the skills and values and attitudes towards a healthy living. And in Arusha in particular, we have also the notion that education is also associated with better economic opportunities. And however, the challenge we have is that majority of the population do not have higher education. In response to that, the government of Tanzania, since 2015, is offering free education in public secondary schools. And with that intervention from the government to educate people up to higher level, the enrollment really surged from 1.4 million to 2.3 million in a period of 4 years. And among the interventions that the government did to really ensure that people attain higher education was improving the infrastructure, building more schools, and also latrines at schools were equally minimal. And this was equally an intervention to equally increase the number of latrines, laboratories, as well as teachers. So there have been incentives towards improving the education and offering it at the free in terms of the tuition. However, with these improvements on improving education and also which is an important social determinant of health and well-being, there's been a challenge of school dropouts. There's been a notable number of dropouts despite the interventions by the government. And free tuition fees. And when we look onto these economic challenges that contribute to school dropout, normally it's free in terms of tuition fees, but parents have to invest on buying books, stationery, and for the day scholars, they also have to get parental care. So when it came to these economic challenges, parents normally make the decision on whether the students could continue or not. So it is also an economic factor that contributes to the school dropouts. And also at household level, there is these also students, the children have to assist the family with household chores, and normally the female are more affected with this challenge. So it really brings a challenge to them that can even lead to school dropout. We also have the cultural challenges of early marriage. And in Arusha, we have the Maasai community, the pastoral communities, who really find that the attitude of the female students will change if they get higher education, which will definitely interfere with their marriage. And parents receive dowry, which is also an economic factor to them, and it contributes to school dropouts. And the UNESCO has indicated on a report in 2019 and 2020 that the dropout rate is at 36% in Tanzania, despite the government intervention on free education at secondary. And the other challenge on the school distance, the students walk up to 10 kilometers a day to reach to schools, although the government has really made efforts on the infrastructure to have more schools which are close at every ward in the districts. However, we also see the challenge on completion rates, especially at ordinary secondary school level, where it's quite lower for girls compared to boys. There have been interventions to address these challenges in order to reduce the number of school dropouts for the students. And there is a traditional approach, and where the number of teachers have increased in these public secondary school, the employment, and there are quite incentives also of obtaining scholarships for students who take education at university level. And again, to counteract the issue on distance, there are more schools which are constructed closer to communities, and also their parent and teacher meetings. So we worked towards having a machine learning approach to predict early the school dropouts. So it was an intervention to supplement the efforts that are done using the traditional approaches. And the machine learning model that we developed, we used data that had 18 features. And among these 18 features, we had other factors associated to health, such as the number of latrines at school, the ratio of the students to the latrines, and also the number of meals, household meals per day. And we developed this model and deployed it in public secondary schools in Arusha, where we worked with educators and also education officers um, at the administrative offices, and we were able, based on the data, school attendance, academic reports, and other important features that were identified out of the 18 that we developed the model with, and we were able to really identify factors that traditional approach did not consider important, and this was quite important to us, that we were really able to contribute to the ongoing efforts of the government to determine the school dropout rates and be able to have the interventions early on. And it was well received by the different schools that we worked with, and we really see, and among the key features of the 18, we had about 5 features, and we had some which were associated with health, and these were not actually picked up using the traditional approaches, and this was our main contribution to this work. Thank you so much.
Thank you so much, Dina. Our next speaker is Jane Weru, who will present on integrated planning as a pathway for healthy informal settlements in Nairobi, Kenya. Jane is a lawyer trained at the London School of Economics and has extensive experience advocating for the rights of Kenya's urban poor. She previously worked with Kitoa Shah Sharia and co-founded Pamajoa Trust to support grassroots movements through legal, technical, and financial assistance. As the executive director and founding member of the Akiba Mashinini Trust, she leads efforts to develop community-led housing and land tenure solutions. So Jane, I invite you to come off camera and feel free to share your screen. Thank you.
Okay, so thank you very much. Like he said, I work for an organization called Akiba Mashinini Trust that works with the urban poor. Now, for the last 10 years, AMP, that's short for Akiba Mashinini Trust, has received financing from IDRC to conduct research and to seek for solutions, evidence-based solutions, in 3 informal settlements in Nairobi, actually 3 of the largest informal settlements. These are Mukuru, Kwajenga, Kwaruben, and Viwandani. These 3 settlements occupy about 689 acres of land. They have a population of about 300,000, and these 300 people come from about 100,000 households. These are informal settlements that do not have security of tenure. These settlements are extremely dense, so they don't have security of tenure. And the settlements, people who live in these settlements live in very small houses. They live in houses of about 10 by 10 feet. The houses are built of corrugated iron sheets. And these houses is 10 by 10 feet homes, which are in essence just one-room homes, and normally clustered around a courtyard of about 10 units, 10 houses in a courtyard that shares a bathroom and a toilet, if they're lucky. Many of the courtyards or plots do not have bathrooms and toilets. And these informal settlements, the 3 informal settlements, are not planned. Like you can see from this aerial photograph, they're not planned. They do not have any roads. So, and they have very, very few services from the state, municipal services, hardly any water brought in by the municipality or the city. So the living conditions are very dire. So one of the things we noticed is that even if somebody wanted to improve the conditions in the settlements, it would be very difficult, because if, for instance, if you wanted to lay water pipes How do you lay a water pipe when there is no road, where there's no space to lay any kind of infrastructure? So the lack of planning, major impediments to doing anything in the settlements to improve conditions. So I mentioned earlier that we got funding from IBRC to conduct research, so to better understand the conditions in these settlements and to see what could be done. So we worked with local communities. We trained a big group of young people from the 3 informal settlements, trained them how to map, how to collect data, and they moved to every single household in the 3 informal settlements. They numbered every door and they mapped every single facility. And from the research we did with the community, we were able to establish that these 3 very dense settlements had only 3,863 pit latrines. These 3,000 pit latrines were serving 300,000 people. So when you do your maths, you can see how many people are being served by 1 pit latrine. And because the pit latrines were being used very intensely, we found they filled up very quickly. And because they needed then to be exhausted, they would have young people come and manually exhaust these pit latrines. And if you look to your left, you will see this little cart. This little cart is an exhauster. It is these young men here exhaust the pit latrines and they fill this little cart with the raw human waste. In informal settlements, they are called ambulances. Then these 2 young men push this little cart to the river and they dump the raw human waste in the river. So the conditions that you can see that in regard to waste were terrible. And one of the things that became very clear is that there was very little you could do without planning in order to improve living conditions. So in regard to water, you can see the conditions. The municipality brings water right up to the edge of the settlements, and then informal providers lay spaghetti pipes that pass through raw waste, both human and solid, and then provide water at extremely high prices to the people of Bukuru. So what we found from our research is that the informal providers sell water between 5 and 20 shillings. So, and that is about 172% to 400% more than the people who live in the former sections of the city paid. So from this, it was very clear that the people of Mukuru suffer a poverty penalty where they pay more than the ordinary citizens for poor quality services and less amounts than the rest of the city. So this is just some of the living conditions. Can you imagine this flooding together with the lack of services? So one of the things that was very clear to us was that without planning, there's very little you could do in the settlement, because the people, first of all, had to agree that there was a need to improve services, and secondly, that they would provide the land, that they would have to demolish their homes and provide the land so that the basic infrastructure could be put in place. And then again, the need then also to work with the state, because the state is the one that is responsible for planning. And then in order also for the state to provide the basic services. So we lobbied closely with the information that we had gathered from the research, and we shared this information with the county government of Nairobi. And we persuaded them that planning must be an imperative for this place. if the conditions were to change. And so they agreed to conduct planning, and they declared these 3 settlements as a special planning area. And using the evidence then that we had obtained with the communities, we were able to put in place a planning process. So we worked with various people, many people. I won't go into this. And we developed plans. And then the county and the national government took up these plans and implemented, opened up roads with the community and implemented, laid sewer and water infrastructure, opened up roads. This is the infrastructure, sewer and water infrastructure being laid by the government as a result of the plans. And so far, a lot has been done. So water kiosks using prepaid water dispensers that dispense water at a shilling instead of 5 to 20 shillings are being developed in Mukuru. So a lot of education has also gone on. This is just an example. And we are now currently working with the county government and the water company to develop policies based on our own experience and practice that can then inform the provision of services in the rest of the city, informal settlements in the city. Thank you very much.
Thank you, Jane. Up next is Deo Akure, who will speak about participatory data-driven approaches to improve urban air quality in Kampala, Uganda. Deo is the head of research and global partnerships at AirCo, where he coordinates research efforts towards tackling air pollution in African cities. He has led the co-design and implementation of air quality programs in over 10 cities across Africa and significantly contributed to developing national and global frameworks to advance science and policy, including Uganda's first air quality regulations. He's a co-facilitator for the African Clean Air Network, a regional network uniting partners across borders and disciplines for clean air actions in Africa. So Deo, I invite you to come off mute and share your screen. Actually, and Jane, if you would stop sharing your screen, that would be great. All right. Hold on one second, Deo.
That's okay.
Let me see if I can share. Great. Stop share. All right, Deo. Hopefully, can you share your screen now? I think it should override.
Let me try that.
Perfect. There you go.
Is that on?
Yes.
Is that all okay?
Yep. Looks good.
All right. Yeah. Thank you. Thank you. And thanks for this opportunity to share our work, contribution to the book through this chapter. I also have to consider that for very many good reasons, a lot of things have happened in advancing the clean air agenda in the continent, which is great. But my presentation today will focus on just one fragment of urban health, that is air quality, one of the indicators. As has been introduced, I'm from AirCo, and we are a research initiative of Makerere University that's based in Kampala, Uganda, with a broad mission to strengthen capacity for air quality management, specifically through leveraging advances in data and technology to increase access to data, but also work with different stakeholders to build synergies for action. So since I'm the one, I think, talking about air quality today, I would like to first give a bit of an overview in terms of the problem. I believe this should be fairly familiar to most people, but just to reiterate that air quality is actually still a major issue in our urban spaces, responsible for more than 1.2 million people. We just had the State of Global Health report released a few days ago by the HEI, really underscoring the importance of urgent action. Which action, if we don't take an action, we will find that our aspirations as Africa, the urban aspirations, including what's stipulated in Agenda 2063, Plus, of course, our fragile ecosystem will be very much at risk if we don't tackle urban health issues, including air pollution. I do want to start off by kind of giving a snapshot, foundational snapshot of air quality interventions on the continent through the lens of this scoping review that was published in 2023, looking at air quality management strategies in Africa over a 20-year period between 2000 and 2019. Just in brief, we had three major themes that emerged from the review: one on technology, policy, and education and behavioral change. So we find this very instructive and useful in terms of informing the different avenues for action and intervention and collaborations. But if you try to do a bit of a dissection of the different themes, especially on technology, a lot of the work that has been happening, at least within the period, is that so much work, efforts in terms of clean cooking alternatives and household energy. But the bad news is that the data side of things, there's still a lot of gaps there. And unfortunately, if you don't have the data, it's even difficult to really evaluate the effectiveness of the other interventions as well. So data really is at the core of what needs to happen as the first step, because if you don't measure, then it's difficult to address the problem. Of course, policy and awareness and public participation. Obviously, when you don't have the data, it's difficult to kind of make the case for policy commitments. And that's also the same for increasing public participation. So let me come back to our case study, which is Kampala, but to lighten the mood a little bit, to say that Kampala, not sure how many people know this, but Kampala actually derives the name from Impala. So the hills of Kampala were very synonymous with the Impala many years ago. Unfortunately, because of urbanization, I never got to see that. I'm yet to find someone who actually, lived in that period or got to at least witness at least one Impala. But yeah, that's kind of where the historical fun fact about Kampala. But let's get back to air quality. The Kampala airshed. This background is important because kind of really very much informs, sort of the intervention structures and the philosophy. The city is a political and economic capital of Uganda with more than 1.8 million people living in an area of 192. Just to put that in perspective, that's population density about 40 times the national average. Uganda is a country with about 240,000 square kilometers. So it's fairly concentrated in terms of the population. That means, these urban environment externalities will be very prominent. We have a daytime population of 4.5. I believe this could be relatable, could be applicable to many other cities as well. A lot of the people who work in Kampala live outside Kampala. In our case, over 2.5 million people actually live within neighboring municipalities. So the Kampala airshed should extend to include the neighboring municipalities. That's what I'm going to be sharing. So about 32% of the manufacturing facilities are hosted within the greater metropolitan area, and that includes all the neighboring municipalities that collectively are hosting more than 4.5 million people. I think like many other cities, in terms of air pollution, a lot of the activities are driven by diffuse sources, individual pollution sources. What this means is transportation, domestic energy like cooking, depending on the nature of fuel being used, waste management, waste burning, and several other sources, which makes it quite complex in many respects to be able to address the problem. But at the same time, it also offers an opportunity to work together with communities and to ensure that we adopt this two-way bottom-up, top-down approach by ensuring that the public is fully part of the process of developing the solutions to clean air in the city. So our case study, although we do work, of course, across different cities in Africa, but this case study, of course, highlighting the work we've done in Kampala, which is a scalable end-to-end and participatory model for evidence-driven actions. So our work is centered on technology innovation, contextual technology innovation, but leveraging the latest advances in the digital space, and data, and modeling, and machine learning and modeling. So one, in terms of the overarching philosophy, is that the participation is integrated across the different stages of the project. So fully integrated conceptualization through different stages of implementation. So through the project life cycle, that element of community involvement is fully integrated. And community here, in a broader sense, that includes the different stakeholder constituencies, the public, the civil society, the government, and the academic organizations, academic partners. So firstly, we are building the portable sensors. I think Blessing Barrow alluded to this, portable local sensors, to develop decentralized sensing networks. I think from our experience is that even just availability of these local sensors, they also have to be contextualized to be able to work effectively in settings like in Uganda and many other settings. For example, access to electricity is still a challenge in many areas. Internet connectivity and several other factors. So trying to also contextualize these technologies to be able to work in our setting. The second stage is developing, through the cloud native platform, developing these tools. One, make sure the data we're collecting is reliable, is credible, but also develop other tools, of course, to support the network. And thirdly, work with the community to build all these different interfaces to make this data accessible. Because what we know is that just having the data infrastructure is not sufficient, and we need to be able to make this accessible to people. And again, different people, different stakeholder constituencies have different needs. So the public, it's not someone who just wants to know, what is my exposure? What can I do as an individual? The policymaker have different needs, and of course, maybe have a researcher. So I think trying to take care of all those different user needs, and we do this by adopting the user-centered approach, and that includes co-designing all the solutions with the users. So yeah, Uganda, of course, mentioned before, when we did this book chapter, we're in the process of developing the first air quality standards. Now that's a reality. And thanks to, of course, working with the different communities. And this is not something that the country can want. Is the first level of the commitment. There's a national commitment to address a problem. Now the next level, of course, is to look at the different aspects of the action to make sure everyone is fully involved and appreciates the need for action. So I do want to conclude by sharing some specific reflection points here. That through this work, we've established that actually Africa, and I think the previous speakers alluded to this as well, that there are shared challenges in terms of air pollution, which is a good thing, because it means we should be able to then share solutions, share experiences, be able to support and share resources to address the problem. And some of these challenges, of course, includes the ground monitoring. There is not limited mechanisms for collaborations. Silos are still a problem, and we need to be able to enable that. There is not much public participation. In many respects, you still have this top-down kind of approaches, like one-sided, and not much involvement of the people who are supposed to be funding these things through that access. Of course, limited policy commitments. If I take one policy metric, that's the air quality standards, you still have more than half of the countries on the continent still having the first air quality, still not having air quality regulations. I also want to emphasize that when you talk about participation, this process transcends or should transcend convening people to a room or somewhere midway through the project, but this process should be fully integrated at different stages, at all stages of a project, and that includes conceptualization where possible, so that you have full buy-in, but also it also insulates from the risk of a project or a nice idea kind of getting to die or not existing when the project ends. So I think that's really, really critical. And we also know that the resources to have these robust frameworks can be prohibitive, and that means we need to start thinking different in terms of how we develop some of these interventions. And lastly, and certainly not least, is that there is no one solution that fits all. Fortunately or unfortunately, a problem like air pollution cuts across all different sectors, and that means we need to be able to work together and also coordinate these efforts jointly to have evidence-driven, especially highlighting the importance of evidence-driven collaborations. With that, I stop here and thank you very much. And as you say in my language, Apoa yote twala.
Thank you so much, Deo. Our final case study presentation is going to be from Elizabeth Bachibinga, who will discuss the prospects of digital health for Africa in Nairobi, Kenya. Elizabeth is an advocate and an attorney at law with 25 years experience. She is a legal advisor and consultant at the Legal Research Consortium, and across nearly 3 decades has led initiatives in governance, legal reform, and capacity building, working across peacekeeping operations and global rule of law programs. So I'll turn the floor over to you, Elizabeth.
Greetings all from wherever you are. As I've been introduced, my name is Elizabeth, and I work around policy, governance, rule of law, and everything. And the presentation today is about the chapter in the book I co-authored with my sister and a colleague, Dennis, who is not able to make it as is in the field. And the focus is on prospects of digital health in Africa and a case study of Nairobi. As you may know or you may not know, Nairobi is the green city in the sun. And I'm presenting today from a cold and gray Norwegian capital, Oslo. So when we speak about digital health in Africa, it's important to pay attention to the context. And as Blessing and Jen have provided the context of what happens, especially in the informal settings and also about Nairobi, I'll not go into that detail, but I'll focus on the presentation. And as you may know or you may not be aware, Nairobi has a fast-growing urban population. There's over 4 million people, and 60% of Nairobi's population are in the informal settings, places where they don't have adequate access to basic services and where the population is already a victim of inequality, as you may talk about it in terms of development and access. And digital health, just like other areas that are being influenced by digital tools, is a system, or there are mechanisms that are available to help bridge the divide that exists between those who have and those who do not have. But before this can happen, it will be important to have the relevant policies in place, the relevant infrastructure, the relevant access, and also the goodwill for policymakers, implementers, and even the community to enjoy the dividends of health being facilitated by digital mechanisms. So with that brief background, I'll now move into the depth of the case study. And in this case study, we looked at Nairobi as the capital of Kenya, we looked at Kenya's use of technology. Kenya ranks high in Africa and in the world in terms of use of technology. It's a regional leader with mobile penetration. The most recent studies reported 40.8% penetration, digital penetration in early 2024. And of this, mobile internet is used the most. Actually, the usage of mobile internet is more than 100% because of the multiple SIM ownership. But it's important to note that this distribution or the ownership is not fair, because in terms of geographical scope and in terms of gender, the access is limited. And so that is the background if we are to talk about how to utilize the digital mechanisms to promote health. While it is important to note that digital access acts as a force multiplier, it helps to reduce distance, to improve access, to facilitate early detection in terms of health, and also to reduce costs. Not everyone has access, as I've mentioned before, and also there may be issues with policy. But that aside, I'll now proceed to talk about the policy environment in Kenya. Kenya has a constitution which has a Bill of Rights, and in this Bill of Rights, the right to health, the right to access to services is clearly established. There is legislation, there are guidelines, and some of these guidelines and legislation are important to this discussion. For example, Kenya has a health policy, 2014 to 2030, which, among others, aims to use information and communications technology for the management and delivery of essential health care. Kenya also has a e-health policy, which seeks to create an enabling environment to use electronic health products. And this is supported by the Health Act of 2017, a Digital Health Act of 2023. And in addition to this, the policy has also established institutions. For example, the Ministry of Health has a e-health unit to provide policy guidelines, to set standards, and support related national health systems. And under the systems, we have, Kenya has a district health information software system, patient finder, digital health atlas, master facilities list, and others. In addition, the government has spearheaded ongoing ICT capacity building for human resources and utilizes e-learning for health professionals to ensure that there's sufficient human resources able to utilize the facilities. And behind all this is the regional and global agendas that inform national development plans and policies. So you have Blessing referred to the Africa We Want, Agenda 2063 for the African Union. Then there's the UN-led Agenda 2030, which sets leaving no one behind, reducing inequalities, ensuring access to health, and others as goals and targets for countries going forward to 2030. So with that, I will now move to some of the issues and challenges. I've already mentioned the life in the informal settlements. And as I mentioned before, 60% of Nairobi's 4 million people live in the informal settlements, and they do not have access, or they have limited access to basic amenities and infrastructures, and as a given, they experience poor health outcomes. Then second to that, health service delivery has been devolved because Kenya has a devolution, or in other places like Uganda, they'll talk about decentralization. So primary health care is provided at the basic level of governance with the local communities. And then the national government is responsible for policy and regulation. But service delivery, as I've mentioned, primary health care is with the local governments. Then referral services, it would escalate from a local, regional to national level of service delivery in terms of referrals. And these, with devolution of governance, there are benefits because services come closer to the people, but the devolution also operates around the existing capacity inadequacies, the limited human resources, the poor enforcement or compliance with enabling policy frameworks and guidelines, limited funds, and also the limitations of the current digital interventions. And yeah, so in terms of our chapter focused or highlighted the service delivery. I'll give some more examples in terms of critical examples. So for clinical management of patients, there's AFIA PAP, an app which supports this. Then there's disease surveillance and mapping of households, and also support for the supply chain management in terms of procurement, and there's financing. There's a digital financing tool. So those are some of the examples. But as I wrap up, I mentioned the Agenda 2030, which talks about leaving no one behind, but it's critical to note because of the context and the problems I've highlighted, many are left behind. So with the poor policy environment, with the digital divide and illiteracy, where even some of the community health volunteers they're illiterate, they cannot read messages that will be sent onto their phones. And also the fact that we expect to have a human rights-based approach where there's no discrimination, where there's a promotion of inclusion. This does not happen because of a number of factors. So as I wrap up, I'll talk about recommendations, that it's important to have research, to continue with research and innovation, to have people involved in policy formulation. And it's not only the communities, but in people, we also talk about politicians, members of parliament, and others who determine where the budgets go. And lastly, it's important to address the digital divide if we are to use digital health platforms to ensure access to health. Thank you for having me.
Thank you so much, Elizabeth, and thank you to all of our presenters so far. I am very delighted now to turn things over to Elaine for our panel discussion, and I invite all our speakers to come on camera and off mute. Over to you, Elaine.
Thank you, Stacy. And thanks to all our speakers for the amazing presentations. There's so much that I like about the case studies in this book. One of that is the diversity of topics, the diversity of social determinants of health that were addressed. I also like the fact that there is diversity in terms of expertise. So we have people with law degrees who have different areas of focus. We have people working in public health, people with expertise in atmospheric sciences, engineers, and so forth. And so I would love for you to bring all of that expertise into this conversation. So we have about 20 minutes to talk. So my first question for you is, how important is community involvement in developing the solutions that you have proposed to tackle urban health challenges in Africa? And how did you go about making your collaborations with community successful? I'm going to start with you, Dina.
Thank you so much. We worked on education with my co-author, Nema, and we really, the features, our background is on machine learning and data science. So actually it was the engagement of the educators, the teachers, and to share with them the findings was really rewarding. And we discussed with them the factors that contribute to school dropouts, and they found our solution quite effective, that they could use the model with the data they have about the students before actually doing the interventions with parents or dealing with the students early. So it was really a cost-effective solution, and it was well perceived, and it was really rewarding for us to be able to share our findings with teachers and students and education officers who do not have a background in machine learning. So it was really rewarding on that engagement.
So the interactions that you had with them, did this happen while you were building the tool, or did it only happen at the end of development?
While building the tool, we had to engage them so it was all a collaborative process from the development up to the deployment. Yes, it wasn't at the end. Yeah.
Great, thank you. Andrea, you touched a little bit on this during your presentation. Can you talk a little bit more about the different community members that you worked with while developing your solution for Kampala? You're still muted.
Yes, sorry about that. Yeah. So what we do is try to kind of cluster the communities into different segments. And that way it's easier to have people plug into, at the right time, in the right places. So we have a broad view of what we call community. We have community starting from, say, for example, students, like there's a data science community, and where we're able to utilize the data, but also directly contribute to developing the digital solutions through kind of the open source platforms. In terms of on the downstream of things, the utility, also ensuring that the different in this particular book chapter, we worked closely with one particular group that is very, very unique and very powerful. This is the informal vehicle mechanics in Kampala, because mobility is a major sector that drives pollution in many countries, in many cities in Africa. And but people drive cars and know to drive cars, but people tend to listen to their mechanics. So what we did was to identify this one urban division in Kampala and try to offer them training on the benefits of good practices and what that could mean for them, but also get them thinking about sort of like the future. And that particular work actually was also integrated when eventually the government was developing the regulations for garages. So they are very much really feeling they're really part of the process, the policy conversation. It wasn't just about, put us in the room and give us a lecture, but rather this actually gave some meaning to the work they're doing. So in summary, kind of, identifying what different areas to plug in different groups, I think we find it very, very critical, and not just lumping everybody sort of like, oh, this is community, but rather what exactly they're bringing to the table, and how do they see value to the work that they're already doing.
Okay, great. And Jane, you did talk a little bit about how you're working with community. I mean, the solutions that you're proposing and the things that you've seen cannot happen without working with those individuals living in slum. How do you go about working with policymakers? How do you bring in policymakers into the solution-making process to ensure that what you're actually proposing gets implemented?
I think firstly is that we realize that in informal settlements, because they're not planned, it is critical that you plan. And like everybody has said, Kenya has a devolved system of government with 47 counties. So under the Kenyan law, county governments are responsible for planning. So the first thing we did was to use the evidence that we had collected with communities to show the county that there was a real need for planning. And we managed to persuade them using the evidence that we had, and they declared this area as a special planning area. And the importance of this is that county governments are permitted by law to declare an area with special development challenges and opportunities as special planning areas, and to develop solutions that speak to the unique needs and problems and opportunities that these communities have. So once they declare an area, the law says that also that the state cannot deploy public funds without a plan. So it is critical that you plan so that the state can then be able to use those plans to draw down public funding. So that's how we persuaded the state using the evidence that we have gathered. And then we use the plan to push the government to draw down funds for the implementation, especially of trunk infrastructure. Like I showed in the pictures, the construction of major sewer lines, water lines, the state even in roads, and then also the construction of hospitals.
Thank you so much, Jane. I'm going to move to Elizabeth. One of the themes that you work on in this is the SDGs, so the Sustainable Development Goals. Can you talk a little bit more? You touched a bit on this, but can you talk a bit more about how all of this work around improving social determinants of health in cities in Africa fits into the SDGs? And in your specific, based on your specific expertise, what are some of the things that are happening to move the needle forward?
Yeah, thank you, Elaine. As I mentioned, the SDGs, and the Agenda 2030 is about leaving no one behind. And when we talk about health, or we talk about sustainable cities, we are talking about a complex system that is made up of all sorts of parts. And the SDGs, if you look at the targets and the goals, if communities work together to attain, for example, the gender equality, or to reduce poverty, promote education, have strong institutions, and the goal 16, where we can have enforcement, compliance of policy that we have in place, the outcomes are better. If we're looking at climate change, if we're looking at reducing inequalities in goal 10, we're talking about, for example, the inequality in living conditions. The formal settlements, as Jen presented, where people in the formal settlements are paying less for water in comparison to those in the informal settlements. So if we're looking at reducing poverty, if we are looking at having better outcomes, we have to look at the whole agenda and look at how it feeds into what we're doing. And when we talk about leaving no one behind, in most circles, I've seen the tendency to focus on the beneficiaries, yet leaving no one behind means carrying along the members of parliament, the representatives, the leaders of communities, the movers and shakers, to ensure that they can provide input in the process. The public-private partnerships are critical, and goal 17 talks about the partnerships and the financing. So we need to have everyone on board. And because I work in governance, I always pay attention to the electoral cycle. And to get the most out of our leaders, we have to pay attention to that cycle and target them when they are seeking for the votes, because that's when they don't have wax in their ears. That's when they're listening to everybody. They're hugging the babies. So we have to pay attention that leaving no one behind means we look at the whole ecosystem. We bring them in, talk to them, talk about companies, how this makes them look good. In the corporate social responsibility, that, if you bring water to this community, we're going to put your name all over, we are going to shout, from the rooftops. So it's really important that we have this approach, and I've seen it work when I worked with the legislature in my country, Uganda. I've seen it work even at national, beyond regional level, where politicians, when they see that they will shine, they will pay attention to and contribute to development.
Yeah,
you.
thank you, Elizabeth. And that's something that I've been learning as well, that there is no public health without politics, and there's no public health without money. And so when you talk to to policymakers, you have to think about what is it that they respond to, and framing about money is one way of having that discussion, but also framing it around impact. They want to know that they're going to have impact, they're going to look good, and they're going to be reelected. So I'm going to go to the questions in the chat. I think the first question is for Blessing. So Blessing, you talked about investments in social determinants of health in cities. And so Paul was asking, who is expected to make these investments?
Well, thank you. I think the point of departure is the government. Those who control political power, they have the destiny of the nation. They have control of, they have monopoly of instruments of coercive action. They make policies, they implement programs, they control the budget. Okay, they have right to collect taxes and set policies. So, I mean, that's the primary role of government, okay, to create security, to create infrastructure, and do what needs to be done. And that's why in the UN, it's all government leaders that go there, okay? Individuals don't just go unless you are invited for something special. So fundamentally, it is the government, okay? And that is what I know, and that's what has obtained globally, okay? That leaders lead their nation, and they have all the resources to do it, okay? I think that's where it is and then you have government at different levels, okay? However, we know that it's important for community participation. There are many places where the government has failed and the communities have taken it upon themselves. I am from Nigeria. At some point, the government refused to give airport to where I come from. The governor, which is a lower level government, called the people and said, they're not giving us airport. We need to. So he organized the people and set up a fund and people contributed. So, and the airport was built. So in essence, those also happen. But the channel is actually through government policy and government action. And so, yes, thank you.
Thank you, Blessing. I recently heard a former Nigerian minister say governments in Africa are like governments anywhere, but governments must be pressured to be effective. And so I think there's an important role for advocacy. And I think that's something that Jane touched a little bit on in her chapter. So Jane, can you talk a little bit about the role of advocacy and how individuals in slum communities have advocated for some of the changes that you see? You're muted.
Oh, sorry, this is not my machine. That's why I keep calling for help. Sorry. I'm coming. So I think a lot of this, like Blessing has said, is that the people themselves have to really push, and they have to push their leaders, and they have to really be at the forefront of seeking for solutions with the support of people like us who are professionals and academics working in this sector. And so when we were doing when we were trying to push for water and sanitation for Mukuru, we realized that the most affected people by the lack of toilets were the women. Because of just the way women are made, really require water and sanitation services to ensure that their reproductive functions, like when they have their periods, they're able to have a toilet that they can use. They're able to clean themselves after they get babies. If they're required to sit on saltwater baths, they have a space to do so. They have the water to do so. I mean, women, and I always say, I mean, if a man needs to go to the toilet, men, they just stand against the wall. If you don't have a toilet, you can stand against the wall and do your thing. But a woman can't squat in the street. So if you don't provide these services for women, women really, really suffer. And so we spoke to women about these issues, and they shared their stories and their humiliation. And we decided that we needed to have a campaign for water and sanitation that was led by women. And the women said that they had waited for too long for these services. And they said that they are too pressed to wait anymore. And so we led this, mobilized very many women. We did petitions. We actually got women to sign petitions. We had about 30,000 women signing for petitions for water and for an inquiry. Actually, they signed a request for an inquiry to be carried out by the government on the unique needs of informal settlement women in relation to water and sanitation. And then from there, it picked up. They saw the governor, eventually we got the special planning area and the planning for water and sanitation services.
Thank you. That is a very powerful example. Going back to the questions in the chat. So how does the panel address the issue that much slum redevelopment demolishes and displaces slum dwellers from their homes, livelihoods, access to education, etc.? Blessing, do you want to start with that?
Yeah, and I think that has been a recurring issue, that you try to solve a problem, you create a series of other problems. And that's why we've been seeking for an approach that is mutually beneficial. And I think the special planning area, which Jen has been talking about, was actually one of those approaches where you discuss with the community and they see the need and they are willing to agree. We had a project we are working with, and the young people within the community, they needed a place to dump waste so that it can be sorted, and the young people went around the community and identified a place, and they created a community meeting where everyone agreed, and they now built that place. So co-creation is important, community-based participatory approaches is important. And that's what we have seen. Otherwise, for example, if you look at the density that Jen showed, if you want a road there, some houses must give, but it's important to create consensus. And what we have seen is that the people are not intransigent. They want the road, and many of them are willing to negotiate, okay? We have had cases where homes are built by government and probably without consensus, okay? And they build this 4-story building and displace all the women who sell on the street. And then when eventually, even if you get the house, you are given the 4th floor. How will you be selling vegetable at the 4th floor? People don't go to the 4th floor to buy vegetables. They buy it on the street. So they were really dispossessed in terms of their livelihood opportunities and so on. Yeah, so consensus building, okay, working with communities, working with religious groups, working with leaders on the communities has always been the way to go. So participatory approaches. Ellen, thank you.
Thank you, Blessing. We're at time, so Jane, I will give you the opportunity to close us, so you can say a few things on this topic.
To add a little on the last question, the last question in terms of displacement. And thank you, Blessing, for that. I'll just say that what we learned when we were doing the special planning area plans is that if you use the standard planning regulations in informal settlements, you will have more than 100% displacement. So for instance, when we were doing the roads, when we were planning for the opening up of the roads, we used, one of the iterations we did was to look at the standard building regulations in regards to the road widths. And when we applied road widths, the standard road widths for development in the informal settlement, we actually realized that we would have all road and nothing else. It actually led to 100% displacement. And so very important that when we do developments, we must be aware of the peculiar and the unique circumstances of informal settlements, and we must develop alternate or negotiated standards with the people and the state. So when you work as then an intermediary in this area, you're actually intermediating a process where people agree that they must move, but then they also agree that the level of movement must not be so prohibitive that it is not worth the development. And so we came up with what we called minimum displacement, that is conservative surgery. So as you we call it conservative surgery, as you're opening up the road, don't be too generous in its surgery. Be conservative and open just what you need for the function that you need. Thank you.
Thank you. And thank you to all our panelists and speakers. Over to you, Stacey.
Yeah, I just want to echo that. Thank you so much for our speakers. Thank you to Elaine for organizing this. What a terrific set of presentations and discussions. If we didn't get to your question, apologies, but we will follow up on those questions with the panel and provide those responses and a link to the webinar recording following this. So thank you so much for spending time with us today. We hope to see you at a future event. Have a wonderful day, everyone.
Thank you.
Thank you.
Thank you. Bye.
Bye, everyone.
Thank you. Bye.